Welcome everyone to our Summer Footwear for Kids webinar, and we're also going to be discussing common types of foot pain that we see in the summer months. So just to let you guys know, we're recording this session, so if you want to look back at it later for any pieces of information, then you'll be able to do so. And a little bit about us. So my name is Maegan Mack, and I am the owner of Playworks Physio. I went to physio school at UBC, and I've been working in pediatrics for the last 6 years, both within private clinics and as well as child development centers. When I'm not working, I'm chasing around my busy 1-year-old. So he's just turned 1 last week. And then this is Keeler. Keeler, you can introduce yourself to everyone.
Thanks, Megan. Really excited to be here. My name is Keeler. I am a Canadian certified podorthist, which means that I work a lot with people with any kind of lower limb issues relating to their biomechanics or how they're walking or how they're moving. I did my undergraduate in kinesiology at SFU, and I've got my diploma in podorthics through University of Western Ontario. And I'm currently working in our Kintic Maple Ridge location, though you may have seen me in other locations in the past if you've ever visited one of our clinics. I'm really happy to be here because we are basically right across the street from Playworks, and we've worked with them for a long time. And hopefully today we can talk about some of the things that you guys should be looking for with any footwear that you get. I'm just going to answer the poll here. I'm from BC. Oh, I'm not sure if my gloves are working here, so one sec. Might have to just take this off. And sorry about that. I can't see anything right now, but if you guys want, I can just quickly try to get this figured out, and then I can get started in just a moment.
Okay, perfect. Yeah, so
Sorry,
I just put up a poll for everyone to get an idea of where you're logging in from. Always interesting to see where everyone is. So it looks like majority BC right now.
There we go. I'm back.
Perfect. Okay, we're full of BCers. I'm going to end this poll now.
And it wasn't even close.
All right. You're all good, Keeler?
I'm all good, yeah. So I can get started now if you like.
I'll just quickly cover just in general what we're going to be talking about today. So Keeler's going to go over the best summer footwear options for kids and what to look for when you're shopping for kids' shoes and sandals. I know that as a physio, we often get this question from parents of like, what are the main things to look for and what are the best options for summer footwear for their kids. So this will be all great information from Keeler. And then at the end, I'm going to talk about some common types of foot pain that we see kids experience in the summer, and then a couple tips on how to prevent these. And then at the very end, we will answer any questions that you guys have put into the Q&A box. And also, I have a special offer at the end as well, so stay tuned for that. So if you guys are ready for Keeler's portion of the talk about footwear, type yes in the chat box. All right, Keeler. I'm just going to unshare my screen so that people can see you. There you go.
Awesome. Thanks, guys. And yeah, if there's any comments, if you flash something in the chat there, if something is not on screen or if something goes wrong, I'll see it real quick here. But basically, to start off with here, Megan asked me to talk about the best summer footwear options for kids. Obviously, getting out of school and into the summer, things change quite a bit, though I'm sure that we've all seen a lot of changes in the last few months, maybe akin to a summer vacation. So hopefully this is advice that you guys can use for now and for the future as well as things warm up. The biggest thing I think that it comes to when people ask me the same question Megan posed, what do I look for in shoes for my kid is a few things. At Kintec, we have 3 maxims we really want to see when it comes to any shoes. It's all about the fit of the shoe, the feel of it, and the function. So the first thing sort of to start with, I think, is always the fit. We're going to cover that a little bit later and how we want to check that fit, but it is the most important part, because if the shoe doesn't fit, then nothing else that we talk about really is going to matter. The feel of the shoe, again, we'll get to, but generally we want the shoe to feel comfortable for your kid. If they are anything like me when I was a child, if the shoe didn't feel good, I wouldn't wear it, and I would make my parents very frustrated. So it can be tough trying to get that to work in the store, but we'll talk about it a bit. The first thing that I think you'll usually look for when we're going to explore this idea of getting a shoe is very much about the function of it in terms of the activity that you're doing in it. So I've got a couple examples of footwear here that I can use as sort of demo models, but essentially you want to make sure that whatever the footwear is, it's suitable for what your child's going to be doing with it. So I've got in front of me just a very standard runner, or in a kid's or a youth size here. And that's great for the day-to-day and for most of what you're going to see kids doing in the summer: walking, running, hiking, a little bit of variety in their sports. But if you're looking at playing a summer sport, if you're looking at anything like softball, or if you're looking at lacrosse, if you're looking at any sort of sports that are more specific and have a lot of different motions in them, lateral movements, you want to make sure you're starting off with a good pair of shoes that are activity appropriate. The same sort of thing goes for sandals as well. If you're looking at getting into a sandal of some sort, we've all had lots of experience, I'm sure, with flip-flops and things that we want to wear in the summer, but if you're planning to do a lot of walking in it, we're going to want to look into how that works a little bit better as well. That's really the first thing, is to look at the activity that you're using it for and make sure it's appropriate for that. It's tempting to try and rely on, a shoe that'll do everything, but sometimes we have to make exceptions to try and make sure that we're getting the most out of our footwear, and we're being safe when we're playing sports, or we're going for long walks, or we're going on vacation. That's when it comes to summer footwear, generally going to cover lots of things like runners, sports shoes, and sandals. So we'll talk a bit about what to look for with those and how to get the most out of that. That ties into sort of the next area, which is what to look for when you're looking for these shoes and when you're shopping for them. As I mentioned before, fit is the most important thing. When you're sizing a shoe, ideally you want to go somewhere that someone is going to measure you. And typically that would involve pulling out something looking like this, which is the Brannick. I'm curious, and usually I'll ask people when they come in, when was the last time you were measured with this? And for kids, it's usually pretty frequently. For us adults, it's maybe not as often, but it's something we should always be doing with our shoes. And I'll use my little bony foot model here as a demo, but there's a few things we want to look for when we're measuring on the Brannick. You always want to make sure that you're measuring this when your child is standing. But if you have this, and typically it'll be a kid-specific Brannick, unless they're maybe a teenager or their foot's a little bigger. But you want to make sure that you're looking at first is the length, and making sure that you look at this small number that is going to show you when they are standing where their toe is going to be, or their toe length. You also want to make sure that the slider is being used on the side to look at the length of their arch, and that the slider on the side here is going to be used to measure the width of the foot. So it's important to not just get one measurement of the foot in length, but to make sure that other areas of the foot fit, to make sure that your child has room to allow their toes to splay out in the shoes, and to make sure that with the shoe, what's more important or very important as well, is to make sure that the shoe actually bends at the same spot that their foot does. A human foot, kids or otherwise, has to bend at the big toe, or at the what we call the metatarsal phalangeal joint line, or at the ball of the foot as you might know it, when they're pushing off. So that's really important for them to be able to walk and run comfortably, and to grow and develop a lot of these muscles that are going to help carry them throughout their life and give them strong, healthy feet. What you want to make sure is that this spot where the toe is bending is also in the same spot where the shoe is bending. So with the shoes, if they bend in the middle of the shoe, or if they don't bend at the toe, you may run into some trouble there. So that's something that you want to watch out for and make sure that when they are in the shoe, it is going to bend, maybe with a little resistance, but it will bend at the toe versus in the middle of the shoe. And that's probably the most important thing to look for in functionality of a kid's shoe. I like to tell people that feet don't usually bend in the middle, or at least they shouldn't. So that's what you want to watch out for first. For a lot of kids as well, if they're going to be on their feet for a long time in the shoe, it's good to make sure that the heel of the shoe has a bit of support. So if you squeeze the heel of a shoe, you can't feel this through the screen, obviously, but there is a stiffer piece in the back that's going to help keep their heel bone straight. We want to make sure that with any kid is that their heel is not necessarily going to roll in or to roll out too much. So having that extra support does make a difference. For kids, not every shoe has to be completely rigid there. Some shoes are going to be softer and a bit more flexible, but it really depends if they're using, a shoe for longer periods and what they're comfortable in. You may want to make sure that they have that extra support for those longer walks or for those activities that they're going to be doing on their feet all day in the summer. When it comes to sandals, we're looking at some similar things. This is a all black Birkenstock, which I now realize is a little tough to see against my table here, but I think it's the only color I have, so bear with me. We want to make sure that with any sandal as well, you're going to get that same flex point and that same bend in the middle of the toe. And you can also look for sandals and things with a little bit of extra support built in. For a lot of kids, when it comes to shoes, we've got a decent amount of selection. With sandals, it's sometimes a little harder to find something that they'll wear and is comfortable, but I know Birkenstocks are a little bit more popular these days for some reason with socks. I can't tell you why that is, but that's the style these days apparently. And with something like these rubber ones, they're very soft and light, which a lot of kids like, and they're a lot less expensive than a lot of the Birkenstocks that you or I might wear. I think they're about half the price. So if they trash them after a summer, you're not going to feel as bad about getting a pair in the next year, which is nice. There's also a consideration if they're going to be using it in the water. Often you'll see sandals like these Keens here, which are going to have more grip on the bottom. So they can use those if you're going on vacation, if you're going to go to Hawaii or somewhere nice and warm. Maybe not as much of a consideration this summer, but if they're going to go to the lake or they're going to be out in the backyard a lot, you might want to look for something that's got that, again, proper flex points, stronger shank to it, and it has something that's related and appropriate to their activity. When it comes to fitting kids, the biggest thing I notice is that they're often hesitant to tell you about these things when they first get into the shoe. Excuse me for one sec here. Sorry. They're often hesitant to tell you, how they feel in the shoe, or, they kind of just want to get out of shoe shopping. I see it a lot because a lot of people don't like shoe shopping. I think kids are a little less patient with it sometimes. So what you have to do a little bit is check for some of this stuff yourself. When you're looking at proper fit in the shoes, we always want to make sure that when your kid is standing, that they've got enough room at the end of the toe. You might be tempted to buy a really long shoe for them and hope they'll grow into it. But again, we want to make sure they've got that proper flex point at the toe. And you can test that by essentially looking at, with the end of the toe, you want to have about half to a full thumbnail length from the end of their toe to the end of the shoe. You want to make sure that across the top of the shoe, there should be a little bit of slack there. You don't want anything that's too loose where their foot's going to move, but you don't want their foot to look like it's about to burst out of the sides either. So those are some things that you can do to try and make sure that, even if they're not going to necessarily verbalize as well, maybe in some cases, especially if they're younger, you can still make sure they've got a good fit, and try to make sure that they've also got a shoe that's going to grip them around the heel. What we don't want to see is, if the foot is in the shoe, we don't want to see that heel lifting out as they walk. If that's a problem for kids because they don't tie their shoes, if they're younger, you can always look at something with some nice Velcro strapping there, which is easy to do. If they're a little older, laces, of course, are going to give a better fit, but you can get stretchy laces if it's going to be a major issue for them to do that. So those are sort of the different things that I look for when it comes to looking at shoes specifically. I saw there's a question in the chat there, but when it comes to the fit and everything, that's a good starting point. Maegan, anything to add or anything you wanted me to elaborate on?
Oh, that's all really good information. I learned a lot with that as well, Keeler. But I think one question that I think would be helpful, just based on the population that we see and some questions we get, is what, well, for one, what sizes do you guys carry? Like, do you carry shoes that would be okay for toddlers, or is it more older kid range?
For us, we start a lot of our sizing around I think the kids 10 range. And this is just to give a quick overview. You've got your smaller sizes going from a very low, I think like a 1, up to about a 12 or a 13. And then you switch to youth sizing, which goes from a 1 to a 7. We would start at about the kids 10 size range, and we would go up into youth all the way up to a 7, which would get them from there into adult shoes. Below the size 10, we don't have a lot of stock on hand. Usually what I would do for smaller sizes is I would refer to, there was one store in our village that closed down, but there's also Kiddos, which is a footwear store in Coquitlam Center. So I know they have a lot of smaller shoes there and some options on style. For us, we have a lot of runners and things like that, but there are some other local partners that are good to look at as well in the Coquitlam Port Moody area. And then if not, we can always look at other areas. If you have specific questions, most of our stores will have someone that will kind of know the general area and be able to tell you if they have local stores that they've worked with that have more sizing available. And as we see, those sizes come in, we're taking those measurements and we are trying to expand this over time. But for us, kid shoes are a relatively new thing. So we're always looking for feedback and, to know what you guys are looking for and what we can start bringing in.
Okay, perfect. And then are the guidelines for what to look for in shoes, that would be the same for a younger child as well?
With younger children, it's very much the same. I always come back to that flex point in the shoe and making sure that when you look at the shoe, it always, even if it's a flexible shoe for a younger child, which, they're not very strong on their feet and they're not going to need as rigid of a shoe as an adult. But we always want to make sure the shoe always bends first right at that sort of big toe joint line. So that also means that when the shoe is being moved, I'll just look down a little bit here. We want to make sure that's sort of where the shoe can roll forward. That'll encourage them to, again, push off through those toes and develop those strong and healthy foot muscles and allow them that freedom of movement. If there's a problem with those areas, if you've talked to Maegan or someone at Playworks and they want something different, you can get shoes that have more support built in. But for most kids, if their feet are healthy and pain-free, you just want to make sure that the shoe works with them and not against them. And that's, I think, the most important feature to look for. Beyond that, for younger kids, you might have a little bit more flexibility in the back of the shoe, and that can be okay. As long as it's comfortable for them and they can, walk and run and do all the things that they love to do.
Perfect. Thank you. Was that good for you, Keeler?
I think I've covered a lot of the sort of technical details when it comes to how we fit shoes.
Okay.
And it sometimes is difficult to remember all these little tips and tricks that people have, but that's why if, whether you're looking at getting a shoe with us or just looking at getting sized, we do encourage you guys to give us a shout. And we are happy to go over all of this stuff in store because every person who works at Kintec is aware of these and other challenges that you face when you're fitting shoes for children. And at the very least, we can offer some advice and look at your mechanics or the mechanics of the foot with your child walking and help to advise with what to look for when you are making that purchase so that you have the knowledge to help you make those decisions and empower you to know what to look for, not just to say that, this is exactly what you need and, you have to, only come here to look at that. We want everyone to have that education.
Perfect. Thank you so much, Keeler.
Yeah, no problem. And I saw a couple of questions in the chat, but I can always wait till the Q&A to answer unless you want to go through any of that stuff now.
I think I see one from Leisha on shoes for toe walkers. Maybe why don't we hold the questions till the end just to make sure that we get through everything first?
I'll make a note about that as well. So I'll remind you when we get to the end of the foot pain, we can talk about that too.
Perfect. Okay, so I just shared my screen with you guys again. Can you just type yes into the chat box if you can see it? Just want to make sure we're all on the same page. Awesome. Okay. So before I go into the types of foot pain, I just want to give a little bit of an overview of what a pediatric physio is. I'm often asked, why do kids go to physio? What would you see kids for? And so a really brief description is that our job is essentially to trick kids into doing exercises. So we create fun games, obstacle courses, and activities that target specific physio goals that we're working on. We see all kids ages 0 to 18 for sports injuries, aches and pain such as groin pain, any knee pain, foot pain, hip pain. We also see kids for rehab after a broken bone. To improve gross motor skills and coordination with kids. So if they want to improve their balance, if there's a specific thing that they're having trouble with, sometimes we see, especially in kids who are in school or on playing sports, that there's something that they're struggling with compared to their peers. So maybe they want to improve that skill. We do concussion baseline testing as well as concussion rehab, and then we also see kids with neurological conditions, genetic conditions, and other diagnoses. And then a lot of our families do a check-in every couple, like a couple times a year, maybe every 6 months or something like that, to check in and see how their kids are doing and find out ways that they can prevent injuries and pain from happening. And especially because kids are growing so quickly and their bodies are changing so fast, that this is just a nice way to check in and make sure that everything's on track. Yeah, so I'm going to move on to common types of pain. So Keeler kind of talked about flip-flops, how they're a popular footwear choice in the warmer months for sure. And flip-flops don't offer that much support. They actually offer very little support. And we find that they make you grip with your toes just to try and give your body stability, and also just because to stop the flip-flop from sliding around, your foot sliding around in the flip-flop. And so because of the lack of support in flip-flops and in combination with the toes starting to grip, we often find kids coming in with shin pain. So this can be something like shin splints, and then also a more extreme thing would be a tibial stress fracture. So just from like overuse and impact on their shin bone. We also see lots of heel pain. So this could be related to like an Achilles tendonitis or something called Sever's disease. Sever's is basically a fancy name for heel pain, just that the Achilles tendon is pulling really hard on the attachment at the heel in kids. And Sever's is specific to, it's most common in the adolescent and early teenage range, because that's when kids are growing a lot, and with lots of activity and stress at this site, it can cause heel pain. And so with flip-flops and the toe gripping, then it can result in more heel pain in the summer months for sure. We also see pain at the bottom of the feet, and so plantar fasciitis, I'm sure most of you have heard about this. We also start to see bunion development sometimes, and this is connected to a few things, but one is that in the summer months we find that kids are not as active as they are during the fall and winter. Maybe they're not in as many activities, perhaps they're sitting on iPads a little bit more, probably especially right now during this COVID time that we're in. And so that can cause the hip muscles to turn off or take a little snooze. And so what we find is that when these hip muscles aren't working as well as they should be, kids will use their toes to grip for more stability. And this can cause kind of the start of bunion development. And the other reason why the hip muscles play into this so much is that your hip muscles really control your knee alignment and also how your foot position is during walking and running. And so if your hip muscles aren't working as efficiently as they need to be, then it can cause the foot to pronate or turn in more, and that puts more stress on the inside of the foot, and that's on the inside of that big toe is where the bunion would develop. So that's kind of the reasoning of why we sometimes find this in kids around now. Knee pain, hip pain, low back pain. This is from wearing flip-flops or not supportive enough footwear in the summer, but we see it mostly in kids with poor core strength and bad posture. So it's kind of a combination of these things that lead to the kids compensating and using other muscles more than they should be, and then that results in pain in these different areas. So younger kids, I'm just gonna actually, before I go into these specific age ones, I wanna just get an idea of the age of your kids. So if you have more than 1 year, welcome to vote into multiple categories, but just so I get a sense of everyone's age range. Okay, we actually have like pretty good mix, but a big portion of the 0 to 3. Okay, so I'm gonna end that poll now. You can see the results really quickly there, but mostly 0 to 12, I'd say. Okay, so in younger kids, the bones in the foot aren't done ossifying, which means the bones aren't fully hardened and turned into bone until the age of 3, so around 3 years old. And so under this age, under 3, as much barefoot time as possible is what we try to strive for. Obviously, there's going to be situations when you're out in the community and outside of your home and your yard where you need to wear shoes, but when you can, trying to have barefoot time is really important. And then being barefoot helps their little foot muscles develop. And so within the foot, there's all these tiny little muscles, and these muscles are what form, as they get stronger, they form and shape the foot. So this is when you start to see the arches develop in their feet, and that is from those muscles that are getting a chance to work. So when kids this young, so under 3, they don't have enough barefoot time, or they're in a more rigid shoe, and that doesn't allow their foot muscles to work as often and get stronger as needed, then that can just lead to their foot not fully developing in terms of the shape and the strength of those muscles. So then we get the preteens and teens. This is kind of, I guess, like the adolescent age group too, where you probably have a lot of kids wanting to wear flip-flops here. And like I mentioned earlier, that this can cause overworking of the tendons. So during the fall and winter, kind of what I spoke about before is when they're wearing shoes and the foot muscles can actually turn off and go to sleep. So similar to how the hip muscles can turn off, the foot muscles can also stop working as efficiently as they should be. And so this can lead to the tendons overworking when kids are wearing flip-flops, because the muscles in their feet aren't working that well. So then their other muscles and tendons in their foot have to tighten up and compensate to make up for the sleeping foot muscles. When foot muscles don't properly absorb shock, because of the poor alignment or the weak muscles in the feet, then that's when the tendons and the bones in the foot and lower leg, they have to pick up the slack. So that's when we see kids coming in for that heel pain, ankle pain, knee pain, and hip pain as well. And then the other factor is that young kids who are growing really quickly, there's already increased stress on the tendons. So as the muscles are quickly stretched out from growth spurts, this means that their tendons are already being overworked. And then you add in wearing unsupportive footwear such as flip-flops, and then you're going to even further stress these tendons. So in kids, how it works is their bones actually grow first, so they lengthen, and then the muscles are stretched. So if you think about a rubber band, if you stretch that, that's what happens to the muscles as the bone gets longer, and the muscle length has to catch up to the length of the bone. So when kids go through a big growth spurt, then you can imagine like the elastic band is being pulled further apart, so there's more tension on it. And that's where we see the tension in the tendons. Does that make sense, everyone? Can you type yes in the chat if you're following me so far? Awesome. I just realized, I think I forgot to mention a point for the younger kiddos. I know we have quite a few parents here with the smaller kids. So I mentioned barefoot is important, but when you are in places where they do need to wear shoes, we like to suggest finding a sandal that wraps around their heel. So similar to, I think Keeler held up a Keen sandal, something like that, that wraps around. Oh, that one doesn't wrap around. I think I have seen some Keens where the heel is wrapped. That one's good too because it does support the foot, like holds the foot down. But one thing to look for also is to see if you can find a sandal where there is a bit of a heel cup to help hold the foot in place. Did you want to add something there, Keeler?
I was going to say is I think I do have the Keen here. It's got a heel strap on it, but when it comes to finding a bit more of a heel cup, that can be good if you do want a little bit of extra stability in the back. But I know for a lot of kids, the Keens are great because they stay on the foot really well, and you don't have to worry about them sliding in it or you know, hitting the wrong spot.
Perfect. Okay. So just before I get into the tips to prevent the different types of pain that I've been talking about, I often get asked questions about how kids' feet look. So often parents will say, oh, my child has flat feet, or sometimes they'll say, oh, my child's foot looks different than mine, it looks funny. Who has had questions about their kids' feet like this? Can you type yes into the chat just so I know if there are people here who've had the same concern? Couple yeses. Okay. So the one point that I want to make about kids' feet and what they look like is that there's a whole wide range of types of feet. So you'll see flat feet, you'll see feet with really high arches, but the important thing to remember is that it's not so much what their foot looks like, but it's more about how their foot functions and how it moves. So that's what's really important. So a foot is supposed to be able to move inwards and outwards, or the technical terms would be to pronate and supinate, depending on the activity that you're doing and the motion that you're doing. So a foot can be flat and totally functional and not create pain. But then there are the cases where a child has flat feet and they are not as functional, and that can lead to foot, knee, and hip pain. So just a little side note on, it's not always a bad thing what the look of the foot is, it's more about the function. So getting into some tips to prevent pain, if you're going to be walking or hiking or doing other activities for longer amounts of time, I'd say like if you're going for a walk that's longer than 20 minutes, I would suggest wearing a running shoe or a more supportive option, just to give more support. and to prevent that toe gripping that can happen if there isn't enough support. I spoke about barefoot time earlier, and I think kids of all ages would benefit from this time to help wake up those foot muscles and strengthen them, and then just give more support to their foot if those muscles are stronger. On days where kids are really active, have them stretch out their legs at the end of the day to help reduce any tension. So with kids growing and their muscles already being on stretch and having a lot of tension, if you add on a really activity heavy day, that can add even more tension. And just doing a bit of a stretch or a little bit of massage to those muscles after that long day can help just prevent any aches or pains that may come from that tension. And then if your child is experiencing any pain, so in their feet, their knees, their hips, you can always see a pediatric physio to help find the root of the problem. What we find is that the faster that these problems are addressed by a physio, the quicker that they can be resolved and less compensations can happen due to letting, like if you let the problem go for longer. And you'll be surprised that kids can correct their patterns and improve their muscle functioning much faster than us adults. So just to give you a quick example, we'll see kids to work on, for example, strengthening their foot muscles or strengthening hip muscles, and it may take them 2 to 3 weeks to get to the same spot that would take me probably a good 8 weeks. So because their bodies are young and their bodies just learn so quickly. So if you notice any pain, I would suggest getting it looked at sooner than later. All right, so that is the end of our presentation. If you have any questions, you can send us an email. It's hello@playworksphysio.com. And if there's emails specific to Keeler, I'm happy to forward them on to him as well. And then if you wanted to book a physio assessment, most are covered under extended benefits. We're all in BC, so it's all good. Even if you're not in the Lower Mainland, we can do a video session, which is essentially like FaceTime. And you can also follow us on social media. It's at Playworks Physio, and we post information and blog posts there that you can check into. Before we get to questions, I just want to see in the chat if you can type your biggest takeaway from today's talk. So either from what Keeler was talking about or the things that I covered, just one thing that you've learned today. Barefoot time is good. Awesome. Okay, and then I mentioned at the beginning that I have a special offer for you guys. So I will email you and get in contact with you to either send you a free exercise program specific to helping wake up those foot and hip muscles, or if you wanted to book a free, no charge consult to have your kids' feet looked at, just type in the chat box. You can either type in exercises or video, and then I will keep track of that and get into contact with you for whichever option you've chosen. Perfect. Okay, so Keeler, why don't you guys can keep typing into the chat if you want. And then Keeler, I think there were 2 questions for you a bit earlier. Do you want to start with those? There was the toe walking one and
where to measure shoes and where to measure people's feet in the Lower Mainland. I think was the other one that was sort of
Okay.
knee specific. And then there was one about stretches for you, which it sounds like you're covering. I will definitely answer those questions. I wanted to take 1 minute first and just, first of all, thank you, Maegan, for putting this all on. This is great. And I'm happy people are seeing, you know, a lot of stuff that they can take away from it. I wanted to add really quick too, when it comes to injury prevention, I see a lot of the same questions you do. And you know, we do send a lot of people over with a lot of those questions, which you've addressed thankfully today. One thing I wanted to get your take on as well is the importance of rest days with kids. When it comes to a lot of kids these days, I find they're getting more and more active as they grow, especially with specific sports. One thing that we've advised many people to look at, especially when I'm seeing them for things like orthotics, because of a pain issue, is looking at how many days off a week they get versus how many days on if they're someone who plays, say, lacrosse and they run track and they have PE 3 times a week. Is that something that you see any sort of guidelines around or anything that you can add?
I think it's very child specific. And I guess really depends on where they are in terms of growth spurts and things like that. But I would say having at least a couple rest days throughout the week, I think is helpful. And especially when kids come in with pain, depending on how severe any of the issues are, sometimes it is helpful just to take a week off from practices and games, because yeah, and I think some of you may have noticed now that since all the sports have been put on hold for now, that a lot of your kids, if they were having any complaints, they probably have gone down a little bit now just from being home and resting. And so I think rest every so often is definitely good depending on the situation, because there's for sure the kids that do activity 7 days a week and have back-to-back things in a day and they're totally fine. So yeah, I think it's more of an individualized kind of approach for sure.
That's awesome. Thanks, because we see a lot of that I see a lot of that with kids with injuries, you know, mostly who are coming to see me, but I think it's good to be aware of the importance of rest. And I also wanted to ask you a quick question as well, just when it comes to your discussion on the appearance of the foot versus the function of the foot. I could not agree more because I see a lot of people coming in and you know, might be worried about their child's flat feet or something similar. And one thing that I'd always discussed with some other colleagues is pain being a good indicator of, you know, to intervene or not to intervene. When you have a functional flat foot and, you know, a lack of pain, to me, that would indicate that we probably don't want to, you know, look at any kind of extra support or anything, versus if there was a flat foot and there was a related pain condition, that would be worth investigating from, you know, the physio perspective or from a podorthic orthotic perspective. Is that a fair sort of statement as far as pain being an indicator of that that sort of decision to intervene and to help with the kids and provide certain support?
Yes, definitely. I'd say that pain is an indicator that we don't want to ignore. So if your child is saying that their feet hurt, I think it's worth getting checked out just so that we can see what the cause is, and if we can give you guys some things to help manage the root of the problem. This is kind of also where I spoke about the check-in. So one thing that we look at when kids come in just for their general check-in is we do look at their feet and how their hips and leg muscles are affecting their foot position. And so this sometimes catches an issue before it leads to pain. So by the time we see pain, it's usually that there are these compensations that have taken place. So yes, listen to pain. And then also if you have benefits and if you're interested to do just a general check-in and see how everything's working to prevent that pain from coming on later.
Awesome. Okay. I would love to answer some of the questions that were coming up. I was just making a quick note of some names, and a few more have been asked. So if that's okay, I will get to those and let me know if I miss any. Um, as far as the questions go, one of the early ones was from Leisha, who asked about toe walking shoes. That's something I wouldn't mind getting your take on it as well, Maegan. With toe walking, there can be obviously a lot of different causes to that, whether it's something is structurally unable to plant the heel, or whether it's just that there's some maybe muscles that are not as coordinated or not as functional as they should be. With most kids looking at toe walking, I would want them to be assessed first, preferably by someone like Maegan, to try and determine the root cause of that. I know we've had many of those clients who have gone back and forth. And from there, essentially try to find a shoe that will, depending on the purpose of the treatment, either accommodate their foot so that they can make better contact with the ground with their heel, or potentially try to help encourage them to make that contact by using some kind of insert. What are your thoughts on that, Maegan?
Yeah, I agree with you, Leisha. I think, yeah, if you're still on this call and if you're okay to type yes or no if you've been to physio. I know that we have some patients' families on this call, so I just want to see. So type yes if you have been to physio, if you're okay to share that. But generally, so toe walking can happen for a few different reasons. So one, it can be more of a structural limitation. Two, it can be like a sensory thing. So when you walk on your tiptoes, your body actually bounces a lot more, and some kids like that vestibular input. Not to say that toe walking is okay for that, but that's one of the reasons why we see toe walking. And then another is a bit of a muscular imbalance. So if the muscles on the front of your legs, so your quads are a little bit more dominant, and your hip muscles, which are on the back, are working a little bit less, then sometimes you see these patterns that can lead to toe walking. So I'd say that getting checked out to see what the reason is for the toe walking is beneficial, and that also will help Keeler or wherever you're going to look for shoes, help choose the best shoe depending on the reason for the toe walking.
And she did mention in the chat as well that it was a sensory reason with autism. So that's something that with that, obviously you'll probably have a more detailed treatment plan with that. But if it is a sensory input thing, and I know in the past with some clients to help with their acclimatization to that pressure under the heel, we have used things like lifts in the shoes or things to try and help sort of normalize that contact. But it definitely would be something I'd want to talk to someone like Maegan first and have that assessment done to try and set a plan, essentially, because I know that there are some out there, there are some people who I've seen toe walking shoes and things like that, and they try to discourage toe walking by using a very stiff sole. In theory, that can work quite well, but I would always want to have that evaluated first because there might be other options that would be more suitable for the individual case.
Perfect. Yeah, and something like you had mentioned, Lisa, how your oldest has autism and you think the toe walking is sensory related. If you were to get that looked into a bit further, there's also a lot of reflex integration type stuff that can be used to help with toe walking in these sensory seeking kids. So that would be maybe something to explore.
Awesome. And thank you for the question. For Vicky, I think was the next question about where to get the feet measured, where to go in Canada. And of course, I'll throw out a quick plug for Kintec. We do have several locations. If you go to kintec.net, you can look at our store locations. Some of our hours have changed with COVID happening but we are able to still measure feet. I showed everyone the Brannock earlier. I have one other thing I didn't show in the initial kind of talk here, but if you guys can sort of see my iPad here, we've also got a way of measuring the feet that are, it's using a scanner, which I don't have pictured, but it reports to an iPad. It's completely touchless other than standing on a platform, and it can actually take a 3D measurement of the feet using cameras and tell us the shoe size. Hopefully your kids' feet aren't as big as mine, but it's something that we can use to get more information without having to get too close to your child, and making sure we can still socially distance ourselves. Barring that, I would argue that any store that sells shoes and purports to do a good job of it should be able to measure the feet and should know how to do those 3 simple things that I showed. If they don't have a Brannock in the store and they just sort of throw stuff around and ask what the size is, I would be hesitant to expect a good fit to occur from that experience. But that might just be my old school shoe fitting, technicality talking. So hopefully you can come and connect with someone like us. If you're not in the Lower Mainland, hopefully you can find a local independent store or someone similar that can help you with that. I think for oh, go ahead, sorry.
Go ahead. I was just going to say there's another question.
Yeah, I saw a few there. There's one from Jen and one from Gurpreet. I think the next one was from Jen regarding a style of shoe for a 3-year-old for trail outdoor and for walking on things like stone. With a young kid like that, I think it's important to remember what Maegan was saying about allowing the foot to have some freedom and some range of motion. So if we go back to the discussion on the foot, making sure that the toe and the shoe can bend and allow them to have that freedom of motion, I think that's really important for someone who's that young as well as what Maegan was saying about the barefoot time when they're at home or where it's possible. If you are going to look at a shoe for walks on trails and surfaces like that, I quickly ran out and can everyone see my screen right now?
I can see it.
Okay. Okay. It sounds like people can see the screen. So I grabbed a shoe. This is a youth shoe. So as I mentioned earlier, we're a little shorter on stock. That's below a kid's 10, which would probably be for a child who's slightly older. But with companies like Asics, this is just one of the brands. I know they make smaller shoes, and this is a model called the Venture. This is a trail shoe, and you can tell that by looking at the rubber on the bottom. It's got essentially full coverage of blown rubber, which is very tacky, like the tread on your car tire, compared to some of the other shoes where, and this is a little bit harder to show, this is an all black one as well, but the rubber is very soft when I push on it. It's very compressible. And this is more of a road shoe or something for softer ground. You can also look at the tread pattern where with this shoe, you can see it's got these little lugs or sort of these studs in the bottom. Those are going to help give grip on things like gravel and more soft ground versus something that is more road-based like this other shoe, which is, it's got small little protrusions, but they're very flat overall. So that's kind of the big thing I'd look for. And sometimes with shoes, it's hard to get every little thing you want with a shoe for someone that young. You may not find it as flexible as you'd like, but if you can at least find something with a good grip, you can make sure that they're not going to wipe out any more than a kid at that age usually would from their shoes not being the right type for that activity.
Perfect. And one other thing just to add for Jen's question, because under 3. So we do want to look for flexibility in the sole, but the other thing I would recommend for that type of terrain is when you squeeze the heel cup of the shoe, so kind of the back of the shoe that wraps around the heel, you want to look for something that's a little bit stiffer, that doesn't just collapse in, and that will help provide more support to their foot and help keep their heel in the shoe, so not slipping out as they're walking. So that's just another thing to add in for that. And then
there was a question from Gurpreet as well about sandals. Was that what you were looking for?
Yeah.
Okay. So again, looking at for a 3-year-old, again, it's something that can be a bit trickier, but I really like to fall back to sandals like the 2 I brought out, which are the Keen and the Birkenstock. These are both adult sizes, but both of them make essentially the exact same shoe in kids versions. With these ones, they're not necessarily going to have as much of a heel cup. They may still have a heel strap to keep the foot in the shoe. You may be able to find certain models from them that are more enclosed, but with both of them, you can get a shoe that does have some flexibility to it. You can get something that's going to stay on their foot. And with things like Keeler Birkenstock, they do have either a decent cushion in the shoe, or they have a little bit of support in the shoe. Not too much, considering the material it's made of. It can still flex quite easily. A lot of them are able to be purchased with back straps or with something like that as well, so it'll stay on the foot well. And as I mentioned with the rubber Birkenstocks, they're a lot cheaper for kid specific models, and I found them to be really good for what we've carried in the past. But some places, as I mentioned, like kiddos might have some others. Yes, so some of them do. This is the Arizona. Some of their models, I think the Rio was one that we used to carry for kids, like the city in Brazil. And I think they have one called the Milano as well. I don't have those on hand to show you, but they do have at least a back strap on them to keep them on the foot. A heel cup is great if you can find it in a sandal, but it's sometimes hard to find that in the sandal versus in the shoe. So if you can at least get the strap, it'll sort of get that foot sitting in the shoe and not coming out of it.
And then Gurpreet, another brand of shoes for the younger kids that I know have been really great in terms of support are Stride Rights. So I'm sure you've heard of them for just like day-to-day shoes for the little kids, but they do have sandals as well, and they have ones that I think cover the back of the heel. So that would be another option to look into as well. And then there was another question.
There was one for you from Estelle about stretches at the end of the day.
Exercises.
Sorry, I got carried away talking about shoes. So.
Okay, we'll answer this
Estelle.
last question, then we'll wrap up because we are at the hour mark. But for stretches at the end of the day, just some common and easy ones to do would be like a calf stretch. So Estelle, how old is your child? Depending on the age, so if they're older and you can kind of demonstrate and show them, they can hold their foot up like against a stair or even against the wall. Okay, so younger, so maybe not quite for that age group. So for the older kids, they can put their foot up against the wall and keep their legs straight and just slightly lean in towards it. And they'll feel, if you do it too, you'll feel the stretch just along the back of your calf. For the younger kiddos, what you can do is you can actually do the same movement if they're sitting or lying down, and just bring their foot up towards, so kind of like toes to nose position. And as you do that, if you have your hand on the back of their calf, you'll actually feel a bit more tension as you move their foot up. So I would do that like 30 seconds on each side. You also can stretch out their hamstrings. With the older kids, probably doing it in sitting is easiest. So I'm sure a lot of you have done a stretch like this at the gym or just at home, but sitting, and then you bring one foot, bend one of your legs so that your foot's along the other thigh, and then the other leg is out straight, leaning forwards to feel the stretch in the back. And then with the younger kids, you can have them lie on their back and you can actually do the stretch for them. So what I'll do is I can include these stretches in the exercise handouts. So if you had said that you wanted one of the exercise handouts, I'll include a couple stretches there. I think it's easier to follow if it's written or has a picture rather than me describing it. Sound good? Perfect. Okay, well, thank you everybody for attending. It's great that we could have Keeler as well. Thank you, Keeler, for giving us so much good information. And like I said, if there's any questions that you think of later, feel free to send an email and I can redirect to Keeler if needed. And yeah, stay tuned. I will send out the exercise sheet to those of you who wanted it. And I'll also include a survey in there if you can just take a quick minute to give us some feedback on how you thought tonight's webinar was, and if there's any other topics that you're interested in, then we'd be happy to hear them. So have a great evening, everyone. Thanks for joining.
Thank you, everyone.
Thanks, Keeler.
Yeah, thank you. Anyone's welcome to email me, or you're welcome to give them my email address as well. Always happy to chat.
Do you want to type your email, Keeler, into the chat box just so
Yeah,
that people can
absolutely.
see it?
Good call. I'm going to type that in real quick.
And then I will forward anything to you if there's questions that come in.
Yeah, absolutely. And people can call us Monday through Saturday if they want to, ask questions. Our customer service team is quite good with figuring out the best plan of action for this sort of stuff too.
Oh, okay, perfect. All right,
But
so there's Keeler's email. Thank you, everyone, and I will be in touch soon.
thanks,
Bye.
everyone.